We are here at Valley View. I'm talking now to orthopedic surgeon Dr. Christopher George. You focus on joints and knees, knee replacement, joint replacement, and you've been a part of the hospital for how many years, Dr. George?
I've been here at Valley View about 6 years now.
Okay.
My practice, just like I said, focuses on joint replacement as well as sports medicine. I focus mostly on lower extremity, hip and knee surgery and pathology, both arthroscopic surgery as well as joint replacements.
Now, Dr. George, what brought you to Valley View? Like, what's your background in orthopedic surgery?
Yeah, I grew up in the Midwest. I'm from Iowa originally. Did my residency training in Chicago. Came out here to do a year of sports medicine fellowship training with Aspen Orthopedics and joined the group there, which is how I got lucky enough to stay out here in the area. I've been here at Valley View since I started my practice. I think Valley View is an excellent hospital. It's a small hospital, but it has a lot of big hospital amenities and services, not just within orthopedics, but the hospital in general. I think it's a great place to practice. I think people get very individualized care here.
Okay.
That's our goal in our office. What I always try to do is to, work with the patient, talk with them. What are their goals? How can we get there? Is that therapy? Is it an injection? Sometimes that's surgery, but it's not a cookie cutter model where we're blasting 3,000 of patients every day here, and so I think people really get a good experience here, and that's one of the major reasons I love still working here.
And it seems like, just from talking to other people here at the hospital that work here and people that have been a part of the hospital, I had my sister-in-law had surgery here last year. There really is it's a different level of patient attention than what you're going to find at other places on every level. Is what it seems to be.
I think so. I certainly, that's our goal, whether it's after a joint replacement or if it's, again, just somebody that we're seeing in the office. Our goal is to really focus in on them and figure out what their goals. And in my situation, orthopedic surgery, what's the best way that we can get them healthy or get them fixed and get them back doing the stuff they want to be doing as efficiently as possible.
Now, I understand that you have a specialized machine, this robotic machine that helps kind of do a lot of the procedure now alongside the actual surgeon itself. Tell us about that.
So it doesn't do any surgery. That's a common misconception.
Okay.
So just to reassure everybody, there's no robot doing your surgery. What you're alluding to is our Mako system that I use for hip replacements and knee replacements, and it helps us to very precisely execute an individualized plan. So depending on exactly where we want to put the components for either a knee replacement or hip replacement, we plan that based off of a CT scan. So we have a 3D template going into the OR, and then in real time during surgery, we can adjust that to really dial things in so it's very precise and individualized to that patient instead of just a cutting jig that fits on every single knee that we use. We're really individualizing that. And what we've seen is that we have as good, if not better, outcomes from what we were doing without the Mako. We've had it for almost a year now here. I've been doing it with all my joint replacement surgeries, and especially or specifically to knee replacements. Just with the benefits of the system, we're seeing less swelling, there's less bleeding, there's less pain after surgery, and people are getting better range of motion, people are getting back to activities even quicker than they were before.
So what does it do? So it allows you to finally precisely tune the measurements more? Is that one of the key pieces of it?
Exactly. So it helps to give us an objective feedback to, joint balance, ligament balance during a knee replacement, for example. And then the robotic arm actually helps to make that cut or make the bone preparation very precise to execute the plan that we've set up. So again, it's nothing passive that's happening, but it helps us to very accurately make those cuts. I equate it to any other industry. There's not people that are building houses or building machines or things in manufacturing, all are based off of robotic systems. This is just another aid or another tool to make our outcomes even better for what we're already doing.
So if we were to look at sports medicine a little bit here and going into where we live and the activities we partake in the wintertime as opposed to our summer activities. A lot of people ski, a lot of people snowboard. Is there anything you could recommend for people to kind of be aware of in terms of maybe injury prevention going into their ski or snowboard season? Yeah.
Unfortunately, there's not any way to completely prevent that.
Right.
Not that we're ever root for injuries on people. I don't ever mean it that way. But being prepared, whether that's physically, mentally, and equipment-wise, I think are the best ways to stay healthy. Checking bindings, making sure you're wearing a helmet, things like that for skiing, making sure that things are set ahead of time, knowing where you're going, and being safe. If you're tired, take a break. But there's being in shape and being mindful of being in a safe environment and making sure that you're prepared for it. I think that's the best way to prevent or minimize the risk of an injury.
Thanks so much for your time.
Thank you.
Have a great winter. Do you ski and snowboard at all? You get out there and play?
I do. I try.
Come see us in Vail. Thank you very much. We'll be right back with more of the show.